So hello and welcome to the School of Public Health Admissions webinar, where we're going to be talking about the Global Master of Public Health. So thank you very much for joining us today. Firstly, a round of introductions from us. So I'm Hayley Atkinson and I'm Education Manager for the School of Public Health.
I'm Philippos Philippidis, hello from me as well. I'm a lecturer here at the School of Public Health at Imperial College, and I am one of the co-directors of the on-campus Master of Public Health, and I'm also leading a specialization for the Global Master of Public Health.
Hi, I'm Helen Ward. I'm Professor of Public Health in the School of Public Health and in Infectious Disease Epidemiology. And together with Paul here, I'm co-director of this Global Master of Public Health.
And I am Paul Aylin, Professor of Epidemiology and Public Health within the School of Public Health. And as Helen said, I'm co-director of this course.
Hello, I'm Henok Tardesa. I'm the Senior Teaching Fellow in Public Health and course organizer of the on-campus Master of Public Health.
So firstly, just a few housekeeping so you can get the best out of the admissions webinar with us today. So you'll see that you're able to answer us questions as we're talking, so please do. You'll need to press the Q&A function and what will appear is a box and you can type your question directly in. We have another group off screen who will be answering your questions as we talk. And that's Kat, Katerina and Joe. So as I say, please do submit questions as we're talking. In terms of what we're going to be talking about today, we'll have an introduction from Helen, who'll be talking about the School of Public Health and the outputs of the school and the vision of the school. And Paul and Philippos will be talking to you more about the Global Master of Public Health specifically in terms of the programme content, the specialisations and what you can expect if you were to join the degree programme. And then Henok and myself will be talking to you about admissions, which is obviously a key part, so you know exactly how to apply, when to apply and exactly what you'll have to do. And at the end of that, we'll be looking to the panellists behind the scenes where you've been submitting your questions directly to them, and we'll be answering some questions which you've submitted. So let's get started. Over to Helen.
Thanks, Hayley. So thanks everyone for coming to this webinar. It's great to see so many people online. And I just wanted to say a little bit about Imperial College and the School of Public Health and what our vision is and what you could be looking to join if you applied and were successful. So as you probably know, Imperial is one of the top universities in the world with a reputation for strong innovation, science, technology, medicine, and particularly our global links. Based within the Faculty of Medicine, the School of Public Health also has a strong reputation. It's a rapidly growing school and is led by our director, Professor Deborah Ashby. The overall aims of the school are to achieve better health in populations throughout the world, a very grand aim, I suppose, and we try and address this through a combination of research to strengthen the evidence base for public health, the science base that underpins everything we do. We also aim to train the next generation of public health leaders and researchers. And finally, we influence health policies, both locally, nationally, and throughout the world. So our faculty work on major global health challenges, which is cancer, heart disease, dementia, infectious diseases, and things like the environmental impacts on health. In all of these areas, we do empirical research to look at causes, to establish and describe trends, and we also explore interventions to control diseases and to mitigate the impacts of diseases. We very closely link with policymakers globally, nationally and locally in order to try and translate that knowledge into action and thereby improve health. The excellence of this school has been recognised within the UK. We were first overall in the last research excellence exercise a couple of years ago for the specifics of public health. We also host a number of national and international research centres, but particularly two Medical Research Council centres, one on global infectious disease analysis, the other in environment and health. And we have two health protection research units, which are government funded in the UK. So within the school, we lead on several major national and international epidemiological studies. One example is the European Prospective Investigation into Cancer and Nutrition, EPIC, which is a cohort study of over 500,000 European adults in 15 different countries. And that's been running for nearly 2 decades now to follow up exposures and details about those people and looking at their risks of cancer and other things, as we've now been able to explore. We also host the UNAIDS reference group, estimating and modelling HIV and AIDS globally and projections. And more recently, we have the Secretariat for the Vaccine Impact Modelling Consortium. These are things that have global impact. More locally, we have the Dr. Foster unit in the UK, which has billions of health records, healthcare records, to look at variation in quality of healthcare, and that has also now got a global reach with international data. My own research spans the epidemiology and control of HIV and sexually transmitted infections, and I have a strong focus on working with members of the public in how we can make sure that developments in research are accessible to everybody and to reduce inequalities, which I'm very passionate about. And within the course, I will be teaching specialisations on participatory methods in public health, social epidemiology, and the Global Disease Masterclass. So just a few facts about the school to finish with. There's over 600 staff in the school in 3 large departments: infectious disease epidemiology, epidemiology and biostatistics, primary care and public health, and 2 smaller units, the clinical trials unit and the ageing epidemiology research unit. We run several on-campus degrees, the Masters in Public Health, an MSc in Epidemiology, and another new one in Health Data Analytics and Machine Learning, and we have more than 100 PhD students. We also contribute to teaching medical students, primary care, public health, and global health. So, if you do join the School of Public Health, you'll be part of this very vibrant community dedicated to improving health globally. We look forward to working with you. So now let's move on to the more specifics of the programme. Paul.
Thanks, Helen. So my name's Professor Paul Aylen. My field of research is in using routinely collected electronic data, so big health data, to look at variation in the quality and safety of healthcare. And I work very closely with my colleague Alex Bottle, who is leading our statistics specialisation in looking at some of the methodology around that. So we're really, really excited to be bringing this course to you. It's a fully online degree programme, and we're developing it in conjunction with Coursera. We're very excited to be working with Coursera. They have an excellent track record, and we were very impressed with their commitment to education, and particularly broadening access to education. And we're particularly impressed with their use of evidence-based pedagogic principles. So really looking at how best to take advantage of an online platform to delivering the sorts of materials that we want to bring to you. So why online? Well, we already deliver an extremely successful on-campus Masters in Public Health. It's very oversubscribed. We know also that it's very expensive to come and live in London and study. Also, it may not suit everyone to have to give up a year of work and come and live in the UK and do that degree. And quite frankly, also, we've run out of teaching space, so we can't teach anybody else because we simply can't take on any more students for the on-campus course. So one way of increasing the access to the sort of material and content that we give to our on-campus students is by going online. So by going online, we can use the leaders in epidemiology and public health that we have at the school and deliver this program to as broad an audience as possible. And that's one of the incentives, or another incentive to go online, is to bring education around public health and some of the messages and some of the practical skills that we can develop to a much broader global community. And actually, to that aim, in keeping with our wish to broaden access to education, a fair bit of the content of the degree course we're making available as open access. So right now you can log on to Coursera and look at our statistics specializations and go through those and get a taste for how the degree will feel. Now, when you sign up to the degree, you will get a great deal of additional input from the faculty, from the academics within the School of Public Health. And there's a program around assessment and mentoring that obviously you don't have access to just for the open course. So that is one good reason to sign up to the degree content. It's designed as a 2-year part-time program. And you're looking at probably around about 20 hours a week study. That's quite a big commitment, but it does allow people to continue with their occupation or childcare or whatever else you might do. So it does provide some flexibility around doing this degree. One of the unique selling points, I think, that we're quite proud of with this degree is the research component. The on-campus degree has a very well-regarded research component, which allows our students to do a substantive project, quite often resulting in publication of academic papers. And perhaps one of the challenges that we've had, and we think we've cracked it, is in trying to take that research component and combine it into an online experience. And we've designed it very much so that we take students by the hand, supporting them throughout the course in terms of building their own research project around a topic that they're interested in. Getting them to think about a practical research question that they can do within the limited amount of time that they have. We'll take you through looking at some of the background literature around that research question. We'll take you through choosing the appropriate methodology based on some of the previous talk content and some close mentoring in that stage. And then we're going to take you through some of the more practical elements of research, how to write a grant application, how to justify your resources, take you through an ethics committee application. And then in the last semester of this 2-year course, you will be able to complete your research project and write it up as a scientific publication or as a policy document. And we very much want to build a community of research students within our program, working together, sharing ideas with the faculty who are running this course, and getting something really useful at the end of it. And at the end of it, having a portfolio of work that you can show to potential employers at the end of the course. So in designing the course, we've based it to some extent on the on-campus course, but we've completely taken a fresh look at our learning outcomes looking at the kind of audience that will be we're trying to reach, looking at individual learning outcomes for each of our specialties that we offer, and then basing our assessments on those learning outcomes. As I said, the course is a part-time course over 2 years. We have 3 semesters a year. Each semester you get to do 3 specializations. 12 of those specializations are core, so they're mandatory in order to be able to pass the course. The other 8 courses, you have a choice to modify your degree according to your particular interest. So we have a range of different specializations that you can choose from as electives. So the sorts of specializations that we offer. To begin with, the first semester takes you through some basic principles in public health. So we have a statistics for public health specialization. We have an epidemiology for public health specialization, and we have foundations of public health practice. So you take those 3 in the first semester. The second semester, we have a really interesting specialization called the Global Disease Masterclass, which actually draws on some of the expertise across the School of Public Health who are involved in big, important public health challenges to take you through the challenges that we're working on within the School of Public Health and give you a taster for those particular topics. We also will take you through a module around health systems, different health systems around the world. And then in the second semester, you'll have a choice of an elective specialization, and that could be perhaps around infectious disease modeling or global health innovations. So that's the second semester. The third semester, you have more core specializations, and then you start your research project. And this takes you through building a question that you can answer through research, something that's practical and feasible. So that takes you up to the end of the first year. And then the second year, you have more core modules, more elective modules. And each term, we take you through the research project as well. So you have a research portfolio specialization in the first semester of the second year, which takes you through the methods and how to write a protocol. The second semester of the second year then takes you through some of the practical aspects, as I mentioned. And then the final semester is dedicated completely to the research portfolio. And you will then be able to complete your research project and write it up and submit either an academic scientific paper or a policy research paper for the final assessment. So that's the structure of the course, and it might be useful if I hand over to Philippos now, who can take you through how an individual specialization has been designed, to give you a feel as to what the course looks like.
Thank you. I see that quite a few people joined after we started, so let me introduce myself again. My name is Philippos. I'm a lecturer here, and I'm co-leading the epidemiology teaching for the Master of Public Health on campus, and I'm also the specialization lead for the online masters. So we have taken the content that we teach on campus and we've repackaged it, and we really put a lot of thought into it, into creating a course that, a specialization that will be challenging and engaging for the online community of learners. As Paul said, some of the material will be available on Coursera, freely available for everyone. So it will be online towards the end of this month. So I encourage you to go and have a look. 3 of the courses, so the specialization will consist of 4 courses. 3 of them will be available on Coursera for everyone, and the 4th will be only accessible if you enroll into the global MPAs. Within these 3 courses that will be available to everyone, there will be some material that's only for degree learners. The first course is called Measuring Disease, and it covers the measures of frequency and association that you would find in epidemiological research. Then we look into the different study designs in the second course of the specialization. And the third course focuses on bias, validity, confounding, things that can go wrong and can bias your findings. As I've said, throughout these courses, you will be introduced to some theory through videos and lectures, and that would be available to see by the end of this month without enrolling to the course, and there would also be readings such as published papers or maybe texts that we have developed, and quizzes and peer assessments that would test your understanding of these concepts. Although I've mentioned theory, I have to say that we've made a lot of effort, and this has been done across the course, the degree, to give that theoretical background through practical examples that you can relate to, and we've intentionally chosen them from the global pool of studies and examples. They're not UK specific. And also, we aim to give you feedback on your performance as often as frequently as possible through the quizzes and the peer assessment. If you are doing the degree, as Paul mentioned, you will have extra additional material to work with, and there will be live webinars where members of staff from the School of Public Health will be available to answer your questions or to prompt discussions. And you obviously will have to have a major assessment towards the end of the specialization. So the 4th course of the specialization is about this assessment. And we've made an effort to make it an authentic assessment, meaning that we will ask you to apply what you've learned in a real life scenario. So you would be asked to do things that you might be asked to do if you work in research, or if you're actually reading epidemiological studies and you would like to evaluate whether these are useful or not, what the applications are for your professional life, whether you are a professional or not. And the final thing I would like to say is that we are trying to encourage you to develop skills. So we will provide the necessary support for that, but you will need to do things on your own as well. We will not spoon feed the information. The whole point is for you to learn how to learn and develop those skills together with the staff from Imperial. Back to Paul.
Well, I would just, thanks Philippos, that's really useful. And it does give you a sort of a flavour of what you can expect with the specialisation. If you do the open content before you sign up for the degree, that's not wasted time. So the work that you've done on the open course will be taken into account when you sign up on the online course. So I would encourage you to go out there and see what we have on offer. Have a look at our statistics specialisation and Philippos's epidemiology specialisation to get a feel for how we're delivering these courses. I think you're going to like them.
Great. And now to talk a bit about admissions, which is obviously an important part of considering and applying for the degree programme. And to give you an idea for year 1, so the degree programme will start in September this year, and we're aiming to have 60 to 70 students. So no more than 70 places for year one this year. So what we really feel is we encourage you to apply as soon as possible. Admissions are live now, and you will need to apply via the Imperial College web pages, and it's an online application. In terms of how long it might take us to get back to you on a decision, I mean, approximately 6 to 8 weeks is what we advise. And that's really to make sure that we consider every application in detail and we really consider what's been put in. So likewise, we encourage you to invest and put some time and effort into your application, because it's very important when it comes to things that you might include, for example, the personal statements, including your transcripts and references. So we really do take a broad and a range of information into consideration when looking at the application. And this is why it's really useful to talk to Henok, because you obviously have reviewed hundreds of applications for the on-campus Master of Public Health. So it'd be really useful to hear from you in terms of when you review an application, what you look for, what kind of applicant profiles you see when you're reviewing those applications.
Thank you, Hayley. So to begin with, it's the minimum requirements, which can be found easily on the website, and I expect applicants would be knowledgeable of those. So a 2-1 degree from a UK university or higher, or an international equivalent degree. An English proficiency test, that's also what entry will be conditional on, and then health-related experience or relevant experience. But relevant experience can come in different forms. So a number of successful applicants for the on-campus degree have demonstrated this through voluntary roles, internships, placements, and so forth. So it's about bringing all that together, your drive and passion to do a public health degree, and making the case for a career trajectory that will make effective use of a Master of Public Health degree, and specifically our Master of Public Health degree. So our Master of Public Health degree is an analytically focused, research-focused MPH degree. So what would you do with that type of degree? That needs to be argued well within the statement of purpose. So maybe we can discuss the statement of purpose here. So the statement of purpose is a critical part of your application. So we expect to have a page to a page and a half long. We had very concise and effective statement of purpose. What we want to do is, what we want to see is a specific, focused, reflective account of your qualifications, experiences, and what you will do with this new qualification that you get with our Master of Public Health degree. So avoiding generalities, avoiding things around trying to solve big problems. You need to bring it home into your particular experiences, skill sets, and how you see your career trajectory developing with this Master of Public Health.
So when you're reviewing an individual's application, you really do use that personal statement to kind of help make a decision on whether or not they would join the program.
Yes, and to qualify one thing as well, it's not about restating what you've already said within your CV, because we would have already seen the CV. So we want to go beyond that and look at your particular motivations to make a rational and effective argument for coming on this course. As I said, there's different ways of cutting that cake, so to speak. So it's not just the people with a number of years of experiences that make it to our course. We accept students directly from their undergraduate degrees who are able to demonstrate effectively their drive and commitment to public health through different things like, say for instance, running seminars on campus, or being part of a voluntary initiative in public health, having an abroad experience going abroad and participating in a public health project. So there's different ways of doing that, but it's about effectively demonstrating, because we accept applicants from a wide variety of fields and disciplines. So you can, but you can still effectively argue for why you should be on this course, essentially.
Great, thank you, that's really helpful. And so I think it's really, again, about investing in the application and really thinking and about what you're going to include in the supporting statement. And in terms of when we would encourage you to apply, I mean, as I said before, it's really as soon as possible. And we do currently have a deadline of the 30th of May. And that's really a deadline whereby we anticipate that the programme is going to be highly competitive and very popular, as it is with our on-campus Master of Public Health. So again, we really encourage you to apply as soon as possible before places fill up for the first year that we deliver the programme. In terms of funding and scholarships, because I know this is a really important part of being able to do further study, postgraduate study as well. So we really encourage you to look on the Imperial College web pages. There is a scholarship tool where you can look for scholarships that might be available and might be applicable to you depending on where you're applying from. But we also offer some School of Public Health scholarships for our on-campus and for this new online degree. So we'll have one scholarship available for year one, and that will be to cover tuition fees, whether you're home EU or an overseas and international applicant. But you will need to apply for that separately. So you'll need to make sure that you apply for the degree programme, but you'll also need to apply for the scholarship separately if you're interested in that. And you will need to go on the School of Public Health web pages, and you can read a lot more about the scholarship process and how to apply as well. So all the information regarding web pages will be communicated and sent out to you all that have attended today and registered. So we'll make sure that that information is available to you. I think in terms of what we'd like to do now, because we've covered off everything we wanted to say to you, and you've obviously listened to us a great deal, so really it's now about opening up to hear some of the questions that you've been submitting, and our panellists behind the scenes have been responding to. So what we'll do now is we'll take some questions and see what you've been interested to find out more about.
Yes, could you talk a little bit about backgrounds and what kind of background you need to have to apply to the PhD? There's a lot of questions on that.
I'll take that.
Yeah.
Okay, so it can be varied backgrounds. So a lot of our applicants come from biomedical sciences and medicine, but that's not just it. It can be the social sciences, management, anthropology, sociology, politics, the humanities. So it's about demonstrating that through your experiences, for instance, and the interest that you've developed, that this degree would be a logical transition. Public health is a very broad discipline. It's a very broad church, so to speak. So it does have these appeals, and certainly within our courses, we draw on these disciplines to expound on different theoretical concepts. We draw on from political science, from sociology, from anthropology, and so forth. So it will cater to different disciplines, but it's about how you fashioned your progression and how the degree we are able to see how the degree would be supporting you in that journey.
Could I just add on to that? I think that's really important about the breadth of academic and backgrounds that people have, but also we take people, or we're interested in people from a range of work backgrounds, that some people will come through medicine, so clinical medicine or nursing, midwifery, that kind of thing, where they've been practitioners in the field and see public health as a necessary next step to answering some of the issues that they've come across as practitioners. And I think that public health appeals to a lot of people in that situation. So that's one background, but there may be others, for example, who've gone into health policy or management, who then see that they need some of the more technical health-related knowledge and skills that they don't have from a management background. So we do have people from very different trajectories coming into public health, and we really value that, because public health is not just a broad discipline. In practice, it's very multidisciplinary, in fact. So it's very good to have people who develop these skills together. And as a student, if you're learning with people from different backgrounds, it's very valuable and so creative, I think. So there's no narrow answer. It's a very big answer to that question, but it's a very good question.
So there's another question about how this degree is different from other MPH degrees. Could you comment a bit on that?
Well, I can comment on that. I mean, first of all, this is a totally online course, so there's no requirement for you to come to the UK or other places to do summer schools and things like this. So you can do it totally in your bedroom, you know, or wherever you're based. The other thing I think is the focus on research. And the way, as I've described, that we have tried to really think about how we deliver a research component in an online degree. We want to make this research relevant to you. So we don't just give you a list of topics, we work with you to design your own research project. And we really support you throughout to, in the end, come out with a research portfolio, as we call it, which will demonstrate for your future career that you have the necessary skills, either to carry on with research, or to be able to interpret other people's research and use other people's research to feed into policy and other aspects of your work. So I think it's the completely online nature of the course, and it's also the sort of the focus around research that gives us a sort of a unique offering for the Masters in Public Health.
So we had a question about if your circumstances change over the course of the course, if you would be able to get a PG cert or a PGDip rather than the full master's.
The question is whether or not, if your circumstances change, you could leave the course with a PG cert or a PGDip, which are parts of, but not the whole of a master's degree. And the answer is yes, that's possible. We want people to come and do the whole degree because we think that's a very good and rounded and very valuable qualification. But of course, if somebody is unable to complete, then it's possible to leave with less than that. It is also, it will be possible, not something that we want to build in and encourage everyone to do, but if somebody has different circumstances, then they would be able to apply for deferment, for example, if they wanted to complete later. So yeah, there is some flexibility, but we would hope certainly in this first year that most people will go through the whole thing in the 2 years.
There are some questions about the research project. How does that work? Is there field components? Could you speak a little bit about that?
Okay, so there are some limits as to what you can do in a master's research project. So we're not going to be encouraging people to go out and do massive randomized controlled trials in the field. So I think we have to be a little bit realistic. What we will be doing is working with you in the first specialization to develop a realistic research question. And that may be something like a systematic review of the literature. It may take the shape of analysis of data that are already collected. But we also recognise that some of you out there will be working within agencies, within organisations that are doing research at the moment, and you may have unique access to some data that's available within your organisation, and we'd like to work with you to try and build a research project around that. So I think we recognise that there are some limitations in the scope of what you'll be able to do, but what we'd like to try and do is encourage as much variety and innovative use of what people have access to in their own country, to build a useful and original research project that ultimately could be of publishable quality. And as I briefly alluded to before, we have a very structured way of taking people through the research process. So you will not be left alone to do this research project. We have a number of courses and exercises and assessments throughout this research project that will keep you on track to delivering hopefully what will be a useful bit of research of publishable quality.
Could you talk a bit about accreditation and international recognition? There's quite a few questions about that.
Okay, so that question was about accreditation and international recognition. So we have designed this degree to have a very broad appeal globally, and we have not gone for accreditation in any of the national or regional bodies at the moment. There's a number of reasons for that. First of all, our on-campus Masters in Public Health is not accredited, although it covers the content of the curriculum that you would need, for example, if you're training in public health practice in the UK and many other countries. So we've not felt it necessary, and that hasn't seemed to alter the appeal of the course or the usefulness in people's careers, it has to be said. The other reason that we haven't gone along accreditation is that we have looked at the different accreditations, and they would narrow the options of what we could offer. Many Masters of Public Health accreditation systems are very applied in a particular health system. So, for example, require a lot of skills in delivering public health programs relevant to a particular region or particular country. And that wouldn't be appropriate for the kind of offer that we have. So we don't have accreditation with a particular public health body. However, a master's degree from Imperial College has got very high value in and of itself. And we would argue in most situations, you would be able to use your transcripts from this degree to show that you have acquired the knowledge, skills, and expertise that you would need to perform relevant jobs.
Just to add to that, within the field of public health, there isn't an accrediting body that everyone agrees around globally. And so if you looked around, a lot of MPH degrees wouldn't have accreditation. It's a professional degree. You know, there is an interest and we are looking into things, but it's not something that we have at the moment.
So there have been a number of questions about sort of how the course will run. So could you tell us a little bit about how long the course is and what the timing schedule is like and what students could expect as they move through?
Well, I can talk a little bit about the overall structure. It's a 2-year part-time course. We have 3 specialisations a term. When doing those specialisations, Philippos has talked a little bit about the sort of content and what you can expect within those specialisations. They're divided up into fairly discrete courses within those specialisations. The courses deliver a combination of video lectures, discussion fora, exercises, peer assessments, and as well as input from the academics running the course. So we hope to we will schedule regular webinars, which all students will be welcome to attend, where students can discuss particular questions or issues or current topics with those academics. So we're going to try and it's going to be there's a core component, but there's also a much more sort of interactive component where you'll get interaction with your fellow students and with the academics delivering the course. So that's 3 specializations each semester. We have 3 semesters in the first year. We have 3 semesters in the second year. The last semester is delivery of your research project, writing that up and providing that for the final assessment. Before you start the course, we should say that we have an onboarding course which we're designing, which will get students familiar with the Coursera platform, with the sort of facilities on offer as a student of Imperial, so how to access library resources and things like that. Some general courses around study skills, writing, the library access and how to look at papers and things like that is all covered. So it's a very comprehensive course. We've tried to provide as much of the experience as an on-campus student gets in an online format.
Can I just add one thing about how each week would look, for example? So if we've got for each semester, you would have, most of it would be these 3 courses running at the same time, 3 specializations. So each week you would have 3 different things that you're studying. So the first term it will be epidemiology, statistics and the public health practice. And for each of those, you probably we'd expect about 5 or 6 hours per week on each of those. Some people will take longer to cover the material, some will do it much quicker. And that will be a combination of some video, very short video lectures, 5-6 minutes, interspersed with readings, quizzes, and so on. And then the assessments, which we anticipate to take a little bit longer. If it's a peer assessment, you might have to write a few hundred words on a topic and then share it. There will be discussion forums going on. And for the degree students particularly, some of those discussion forums will be with faculty present and with other instructors. And there will be maybe 1 or 2 hours a week of live webinars where you will have discussions, tutorial type discussions with faculty, with instructors. So it is an intensive course. It's half-time over 2 years, but we do expect it will take 15 to 20 hours a week, every week. So this is nothing to be done just on a Saturday evening, I have to say. It's something that you would have to commit time to.
But you will have the flexibility because the material will be online. So if you are available to study on a Tuesday afternoon, you can do that, or on a Thursday morning. And we are aware that there will be people from different time zones. So when scheduling the webinars, we'll try to account for that. And I guess that they will be recorded as well for those who are unable to attend.
And much like an on-campus programme has been mentioned, we have terms, semesters that will run for a number of weeks, and there'll be half terms as well. So much like an on-campus programme, there'll be that downtime for degree students to prepare, assimilate the learning, and then perhaps looking to submission as well of the assessments at the end of each specialisation. So in that way, it will be structured and scheduled quite in a similar way, but on a part-time basis, and obviously a lot more flexibly as well.
Can you talk a little bit about scholarship opportunities?
Yeah, so in terms of scholarships, as I mentioned before, the School of Public Health have dedicated scholarships for our master's programmes, the on-campus and for this online degree. So for year one entry, there is one scholarship available within the School of Public Health, and that will cover tuition fees only. And as that's an online degree, hopefully that will be benefit for anyone who's successful. We hope that will grow for future years. But anyone who is interested in being considered for the scholarship will need to apply separately online via the School of Public Health web pages, and it is a separate application. So much like the admission to the programme, you'll need to demonstrate excellence in your experience, in your previous qualifications, and then that will be reviewed by a panel to decide who will be successful and awarded the School of Public Health scholarship for this programme. In terms of scholarships more broadly, the Imperial College scholarship tool is going to be really useful for you. So again, go on the Imperial College web pages and have a look at other scholarships that might be available. We'd also encourage you, depending on where you are in the world, to look at your own government funding opportunities as well. There may be opportunities that come from there. So what we really encourage you to do is think about the funding now. A number of scholarship deadlines are often very early and in advance of you starting the programme. So I think really we just advise you to start looking, start researching, seeing what scholarship opportunities there are out there beyond the School of Public Health. But as I say, we do offer one scholarship for this year of entry for the global degree and some others for the on-campus degrees as well.
Can you talk a little bit about flexibility in terms of extending your program? Because people are talking about if they can't complete it in 2 years, can they scale back and do specialization at their own rate?
In terms, the question is about flexibility. We are keen that people finish within the 2 years in much the same way that the on-campus students finish within 1 year. And people want to know whether that's flexible. There is some flexibility, but they are exceptions that you have to have good justification for. And it would not be, I just want to go at half the pace. It would have to be, I want to interrupt my studies for a period. So it's a very good question because it is important, but at the moment we're expecting people to commit to this 20 hours a week for 2 years. Obviously, people's circumstances change and we will accommodate that as much as we can to say that you can do it over 3 or 4 years, but you'd have to actually make a special case to us. That's the way our regulations work at the moment.
And can you speak a little bit about the type of interactions people can expect during the course, and if it's more one-on-one, if there's going to be some cohort interactions? There's a lot of people asking about that.
Well, the question was about cohort interaction and types of interaction. So first of all, with faculty and instructors, there will be interaction on in terms of discussion forums. That's probably the most common form where people will put up questions and will have specific responses from faculty, either in real time, live, in those discussion forums, or once a day or once a week, or depending on what the nature of that particular discussion forum is. And within those, we will encourage also a lot of interaction between the students as a cohort. So the degree students will have their own separate discussion forum, separate from the open content. And we really encourage people to work in cohorts within that. The second area will be through live webinars, when we will have webinars when, like this, we will be talking to you, but unlike this, it won't simply be you typing in questions. We will have live questions, and within that, we will, for example, break the cohort. If the first cohort is 70 students, we will break that down into groups maybe of 10, who will then go into virtual seminars together, sometimes with instructors, sometimes on their own, doing group discussions, group work, and then coming back together as a plenary in the webinar. And we will use that facility a lot. We will use that, at least once a week for each of the specialisations that you're studying. terms of one-to-one interactions, there will be an opportunity for that with our tutoring system. So people will be allocated a personal tutor or personal contact who they will have access to periodically. As Paul said earlier, we're very much matching what happens to students who come to the on-campus course. So all of those things will be available, and some people will use them more than others, but be assured there will be access to faculty. There also will be access to some of the more external. So if it's not an academic issue and it's more of a pastoral issue or a problem that people have that they want to discuss with somebody confidentially or whatever, then there will be access to some of the support services for students at the college.
I think we've got time for probably one more question.
So this is another academic focused question. The students were wondering a little bit about the elective courses that they might be able to take, and when they would know the timing of those so they could see across the course what they'd be able to do.
Well, the actual course, the curriculum, which is available at the moment on the website, has the options at the moment. So those electives, there'll be at least a choice of usually one of three, or sometimes maybe one of two in the first year, but one of two or three options. And there are, how many of those? Four? I mean, in terms of options.
In terms of options, it'll be four
yeah, so 4 choices that you'll be able to make over the 2 years. And so there'll be a minimum of a choice of 1 from 2, but we hope to build that up. And there'll be mostly 1 from 3. And they will run, so they will range. We've designed them to try and be appealing to people with different interests. So some are very much more quantitative, so infectious disease modelling, for example, is a very quantitative one. Others, which would be, say, social epidemiology or the participatory methods in public health, will appeal to people who are more interested in not just qualitative, but more health improvement and those kinds of issues. So there's a range of types of options.
Okay, lovely. So thank you very much for everyone that submitted questions. And what we'll make sure that we do is, as we come to a close of the submissions webinar, is that all the questions that we've received, and we did receive a number of queries before we started as well today, and what we'll be doing is sending that out and sharing that to all of you that have been involved and registered for the webinar as well. So that will be coming directly to you. The webinar today has been recorded as well, so if you missed anything or you were unsure or would like to perhaps pick up on the questions again that we've talked about, it will be sent directly to you, a recording of what we've talked about today, and that will also be published on the web pages as well. And I know we've mentioned this a number of times, but we do really encourage you to have a look at all the information on the School of Public Health web pages, because there's a lot of useful information there that compares the on-campus programme and the new online degree as well, and it probably will give you a lot of clarity over the structure, what will be different, and all the core and elective specialisations that we've been talking about as well today. So I mean, really lastly, it's just to say thank you very much to Philippos, Helen, Paul and Henok for being involved today.
Can I say one more thing? So I'm looking at our video stream here, and we're all looking a little bit serious. And indeed, it is a serious matter, and it's a serious commitment doing this Masters in Public Health. But you will end up with a degree from Imperial College. But what I should say is, it's going to be fun as well. I mean, we've got such great colleagues working on content. The material is looking fantastic. We've got such commitment. I'm so excited. I think we are all excited about this course, and I really think it's going to be something super special.
Yes, very important. Fun is very important in the to talk about. So as I say, thank you very much to all of you who have listened to us today and submitted questions, and thank you to Katerina and Kat and Joe for answering the questions. So we really hope you found it very useful and hopefully enjoyed it as well. So thank you very much.